Yeah, so you find yourself in the UK and you want to do care job. You think you don't have the background. You've not worked in the hospital before, like you've not done healthcare assistant job as a profession. You're finding it difficult, as if you cannot do it. You are so scared. You don't know if you will pass interview. You don't know if that is the reason they are rejecting your application. My sister, my brothers, you have a background. You have. Who is a carer? A carer is someone that help other people who cannot help themselves to do what they want to do. Hold on, let me bring it down for you. This is for people that are new, who think they cannot do this job because maybe back home we don't have a proper care home where we keep elderly people and attend to them, like hospitals where we have nurses and doctors. And we find ourselves in the UK where they have such structure. Now we are feeling like we cannot do this, maybe because you've not worked in a healthcare setting before. They feel they cannot care for anybody. Who is a carer? Okay, let me ask you this question. Have somebody in any way depended on you for their daily activities or living? What do I mean by daily activities? Maybe they want to have a bath, go to the bathroom and have a wash, but they couldn't do it. Have you ever helped somebody to bathe themselves? Have you ever helped somebody to dress up, like they cannot do it and you help that person to dress up? Maybe your sister, your brother, your friend, or anybody, maybe they got sick, accident or anything, they are on bed, they cannot go to bathroom. Maybe you clean them on the bed and change their dress. Sometimes they can't even use the toilet. You have to put what we call continence support, which is pad. You have to put it on for them. And when you think is wet enough, you remove it. Have you done something like that for somebody? Have you tried to help someone brush their teeth? Maybe they are so sick that they can't brush their teeth. Have you helped anybody to do so? Have you, in one way or the other, feed somebody? Like, they are not able to eat, maybe because of sickness or old age. They can't feed. Have you helped to feed somebody? Give somebody food? Yes? Or water? Yes. Have you gone to the pharmacy to buy medication, drugs for somebody, and you help them to bring out the one they will take in the morning, in the afternoon? Have you done anything like that? Have you at any point in time put somebody in the wheelchair? They cannot walk. You push them on the wheelchair to go anywhere they want to go to. Have you done anything like that? Hmm? If you have done anything of this nature, you are a carer. Yes. The only little difference is that here in the UK, we have a home, just like hospital, a structure, a building, just like hospital, where all these people were put together. You come in the morning with your uniform and that title called HCA, or support worker, or domiciliary care worker, to attend to them. Now you worked with them 8 to 8, 9 to 9, depending on your shift pattern, to support them. I will help you understand it the more. Reason I'm taking my time to explain this thing is for you to understand that you can do it so long you have the passion to do it. You don't have to be scared because maybe you felt you don't know what it entails. I'm telling you, I'm explaining it in, coming very low for you to understand that you can do this job. And listen, let me tell you, if you struggle and you happen to get a job, you will be trained. The policies, the procedures, the skills, and every other thing, the company that recruited you will still train you. So where you have to do the hard job is to make your CV to be presentable, write your supporting document to be presentable, and sell yourself when you go for interview. I already taught us, for people that don't I call it don't have experience. We all have experience, but you know, you've not done it like me that have been working in a care setting. You know how to answer such questions like, tell us about yourself, or why we should hire you for this position. You know, if you have not seen that video, go and check it out on the playlist. You will see, if you don't have experience, how to answer the question. Okay, so you have done the, okay, well, how about have you given birth before? Have you cared for a baby? Do you know we have people that work with children, just like we have people that work with the elderly? In the elderly section, we have people that have dementia. Children section, we have people that have autism. You know, so in one sickness or condition, they are the same. So the skills on how to manage each and every one of them, even me that is doing this job, if I happen to go to another care home or hospital or any other place to work, they will still train me to the standard they are working in that place. Okay, so don't be scared that you've not done this job. You've done it. Like I've told us before, our routine at work. You come to the morning, you take handover, you go to the room, you check them, make sure all of them are breathing. You put in the device. Even the phone we use at home, just like normal phone like this, it is user friendly. Once you log in, everything you see there, you don't even need anybody to teach you how to do it. Once you look at it, you already know what to do. So far you can use phone by yourself, you can do it. It's not something too complicating that you cannot do. Stop being scared. Now, the case of a lot of, unfortunately, I hope we've solved it, because I've already made a video on how to write a supporting document. I've already made a video and I've told us, before you apply for a job, do not be too quick. Please take your time and read. If you don't have time for that, leave it and come back when you are free. Read about the job description, read person specification document, prepare yourself for the interview, write a good supporting document. You will pass. You know, if a company advertise one job position, hundreds of people, 50, 20 will apply. Now, they might not want to bring everybody for interview. They will take out their time to sieve people that, you know, in their supporting document or in their CV that is closer to what they want. They will call those people first. So what do you have in your CV? I've already made a video as well on how to do your CV here. But if you still want me to do it, let me know in the comment section. I don't mind. I will take out my time to also do that. If you have been going for interview and you think you are not giving the type of answer they want, please write down the interview questions they've asked you. I will reply. I will tell you how to answer it. I will explain it the way you will understand what they want from you. Like somebody brought interview question, they ask her, NHS, where they ask her, you are 3 carers in the home. One of the carer is with a resident who is so fragile that you are not allowed to leave the person. One of the carer is with another resident making food in the kitchen. She's not allowed to leave the food with the resident. And the other carer is with another resident in the room, ringing, buzzing for help. Now they ask her, what do you do in that situation? Common sense. 3 of you working, you are not, it's as if 2 of you that can help are not allowed to leave the position. What do you do? But that person needs help. So I explained it in the live section, you know, during my TikTok. I said the examiner, the interviewer is looking out for 4 things. I categorize it in 4 things. Number 1 is looking out for teamwork, your team skill, ability to work as a team. They are looking out for you know, safety. Like, they want to see how you will prioritize the safety. Now they are looking out for how you respond to things. There's a way I put it. But I told the lady, this is how to answer that question. If I happens to be there, like I said before, I don't know it all. If you have otherwise answer, put it in the comment section. I accept it. I said, in that situation, because I'm in the kitchen with a resident and I'm not meant to leave that food that I'm cooking with the resident, what I will do, if the food I'm cooking is not something I can switch off the fire, what I will do is that I will put it in the lowest. I will put the gas in the lowest. Now, I have another care worker with a resident that is so fragile that she cannot leave that resident. So what I would do is that I would take the resident I'm staying with in the kitchen to make the food. I would take her to that staff taking care of the fragile one, so she can look after both of them, you know, the both residents. Then I will run to the room to offer help to the carer buzzing in the room. Okay, this is what I told her. This is what I will answer. I don't know if you have something otherwise to say. Okay, they also brought another one that says, you have a colleague that have refused to work. What do you do? You know, whenever interview question comes, I try to, you know, by myself, figure out what they are trying to find out from me. You can imagine, they ask you, you come to work in the morning and your team member, your colleague have refused to work. What will you do? I told them, in that situation, I would speak to my colleague calmly and gently without being judgmental, and ask him what is the problem, what is going on with him, why is he not working. Then I will listen to him attentively to hear what he's gonna say. After that, I would offer help. If he want me to, if my colleague want me to, I will offer help. Then after that, I will have to report the situation. Now, reporting the situation does not mean you are trying to gaslight or backbite or do anything bad to your colleague. No, it is for the management to understand that it's as if you are short-staffed. You can imagine if you are meant to be 3 and one person is not working. You will be short-staffed. It's as if you are short-staffed even when the person is there. So the management needs to know that one of you is not working. So you are not reporting it for the person to lose their job. No, you are maintaining professionalism. So I said in this situation, to me, I would say that the recruiter wants to find out if I have empathy, if I have good communication skill, if I'm still maintaining professionalism. Because if in the end, you know, you spoke to the person, you offered help, and you do not report the situation, the resident or people you are caring for is at risk. So you must have to report the situation. Whenever the management calls the person, it is left for them to answer for themselves why they are not working. Do you get? So, this thing is not something so strange that you cannot do. I am encouraging you that you can do this job. So long you have passion and you want to do it, you can do it. Okay, so if you think you're finding anything difficult, let me know in the comment section. I'm ever willing to help, be it anything. If I don't have good knowledge about it, I will tell you I'm sorry, I don't have good knowledge about that. I'm not knowledgeable in that. But once I have, I'm willing to offer help. Please do well to subscribe to our channel, and all the best.